Every day, Luna watches while the swelling on her son Tiago's brain increases. He urgently needs an operation, but the doctors can't do it. The operating theatre's been out of action for months.
Impotencia.
I feel really helpless, especially this month when we have everything we need for the operation and the operating theatre isn't fit for use. It's out of our hands and we can't fix the air conditioning. We can't decontaminate the place and our boy is getting worse.
Venezuela's public health system is disintegrating along with its economy. Doctors have smuggled us into this hospital in Merida to see conditions firsthand.
The patients, the families, they have to buy everything because here in the hospital we don't have them. So most of the times patients die because their families are out the hospital looking for the treatments.
Emergency wards with broken monitors, a cupboard full of defibrillators, none of which work. Basics like saline, antibiotics and gloves, non-existent. Doctors are forced to improvise, here using a bit of cardboard instead of a car. And the biggest problem of all, medicine. It's incredibly scarce, and those without money simply go without treatment.
Son pacientes que están acá de larga estancia.
There are patients here for 3 months or more with pneumonia, with illnesses picked up in the hospital. And how will they get better if they don't get antibiotics?
Overworked and understaffed, they head from emergency to emergency.
The mother's asked us not to film this, but just down the hallway there's a child having an epileptic fit. The nurses here, there's only 2 of them in a ward where there should be 8, and they don't have the medicine to actually control that, so there's nothing that they can do while this is happening.
Doctors later told us several epileptic patients had died in the last 5 months. Their own safety is also at risk.
We have some inside the hospitals that they steal the light bulbs. That darkness has been really facilitating for the thieves to rob us with guns and with knives.
Some medics have gone on hunger strike to protest the lack of pay, resources and even cleaning products. As a cockroach crawls up the wall of his surgery, I ask Orfram why he's staying.
If we leave, they don't have materials, they don't have treatments, and they're not going to have doctors. So some of us are trying to stay, but maybe if things continue like they are right now, most of us are going to have to leave.
Luna and Tiago don't have that choice. The public health system is the only hope they have to hold on to. John Holman, Jazeera, Merida.